All right, so now I will formally welcome all of you to our discussion today with Laura Helmuth, and Dan will do a more in-depth introduction here in just a minute. But to start off, I want to say hi, I'm Christy Roschke. I'm the Managing Director of the News Collab at the Cronkite School at Arizona State, and I recognize many of the names here. So I know we have a lot of past participants in some of our sessions and some of our students at Cronkite, and it's really lovely to be with all of you today. And for those of you who are joining us in one of our Q&As for the first time, very hearty welcome to you. This is just a really great opportunity to have an informal conversation with a person that has some really excellent subject matter expertise. And so kind of how this will go is I'm going to turn it over to News Collab co-founder, my colleague Dan Gilmore, here in just a second. And he and Laura are going to have a conversation. And during that conversation, you're welcome to put thoughts, ideas, comments in the chat. So we will use the written chat function throughout the conversation. And then we'll be kind of asking those questions on your behalf throughout the conversation. And if time permits at the end, we may even have an opportunity for you to ask a question directly. Do want to just remind everyone that this is an opportunity to have a civil conversation. So we welcome different points of view and civil conversation, but we want to keep it clean, keep it appropriate, keep it constructive, all of those kinds of good things. And I'm sure there will be no problem with that, but feel like I should always say that. So with that, I'll go ahead and turn it over to Dan, my colleague, and we can get started.
Thank you, Christy, and welcome to everyone. And I want to say a special welcome to my sister, Mickey, who is with us from Atlanta, and especially welcome colleagues and thanks, Mickey. And Christy and Celeste, who are the ones who make all of this stuff work. And now special thanks to Laura for joining us. I'm going to put in the chat the announcement that Scientific American sent out when they brought her on board. I'm told that I'm not loud enough. Is that true? You can hear? Okay. I'll speak a little louder if that'll help. We're really fortunate to have Laura joining us because there is nobody I can think of in journalism who's more qualified to talk about these things. And we encountered each other on what was it, a symposium, right? A few weeks ago, and I was just blown away by the great advice that she was giving to people about how to understand the journalistic component in the misinformation wars, and as they relate to coronavirus in particular, but I think it's broadly in science and health. We have a real problem right now, and some real opportunities at the same time in thinking through how we're going to deal with understanding this incredibly complex world that we live in, that we cannot all know everything we want to know about specific things. And in an era where science, health, medicine are incredibly complicated and nuanced and often described poorly by journalists and sadly often by the scientists who are telling us things, we have to think through how we're going to be better at it ourselves in making sure we don't get faked out and that we are getting good information. So I'm going to ask Laura to start by just tell us briefly how you got where you are and why this is your field. What made you do this?
No, thank you. Thanks for asking. Thanks everybody for joining us today to talk about all this stuff. It's really fun to be here with you. How did I get here? So I started out in science. I got a PhD at Berkeley studying cognitive neuroscience, basically how does the mind work. And I really enjoyed doing science, but the pressure when you're in grad school, the pressure is to specialize, focus. and I kept getting distracted by other things. I just wanted to, like the part of going to grad school is learning new things, and that was great. But actually, like doing the experiments and writing it up and specializing, I wasn't as excited about. And I was at a conference presenting some research midway through grad school, and I saw some people walk by with their name tags. It had a little ribbon underneath that said press, and I had this epiphany of, oh, you can write about science. And I was reading the San Francisco Chronicle at that time because I was at Berkeley, and they have had some really good good science reporters. And so it just kind of occurred to me that this is another alternate career that I just had never thought of. And so after grad school, I went to a science writing program at the University of California, Santa Cruz. And that was just a 9-month, like a boot camp type of thing, where it's they just teach you the jargon and the craft and some of the skills. And then I went off and did some internships. And then I've changed jobs quite a few times. So I've worked at Science Magazine in the news department, Smithsonian Magazine, Slate Magazine, National Geographic, The Washington Post, and now Scientific American.
Sorry, I was muted. I do want to shout out about Scientific American. It is, what, 170 some years old. It is the primary publication in its field in the United States, probably in the world. And it's often something that just has, I wouldn't call it a breaking news publication, but if you want the context of the world of science, there is nothing better to read, and I just can't recommend it highly enough. So, well, let me just ask something very broad, and we do want to get to your questions quickly too, and I'm sure Christy and Celeste will have things they want to ask. What, when people are encountering information about science in the media, what I'm talking about average people who are not scientists like you, who do not have PhDs, who are like me, often baffled or at least unsure of what we see. What are the things that you would, first of all, just tell us to do as we encounter this stuff?
I think that's a good question. And, one of the first steps, as I'm sure you've all talked about quite a bit, is just trying to figure out, who's producing this information. Is it coming from a legitimate source? Is it coming from a specialty science publication? Is it coming from a local or mass media newspaper? Or is it, a Facebook group? Is it a press release that's dressed up to look like a news story? Is it, an anti-vaccine site that has all the trappings of legitimate journalism, but is actually just sharing conspiracy theories? And it's really hard to tell. And there are things you can do to identify the source, and that's like a good first pass, of course. If you are encountering real science journalism, it's kind of aimed at different levels. It's some specialize in in reaching audiences that already have an interest in a lot of background in science, but most of them aren't. And the goal is to be accessible to anybody and to have enough information that anybody can appreciate and enjoy the story. And some, a lot of science journalism has to do with kind of mind-bending things. So like not being able to comprehend it immediately is sort of part of the joy. So when we're talking about dark matter or, the shape of the universe or something, like that feeling of sort of awe and like a pleasant type of confusion, like I'm learning something that is a stretch, like that's kind of part of it. But ideally, the language is clear enough and the context is clear enough that you can still be grounded. You can still kind of follow along what the point of the story is. And so I often advise people, if they're talking about something really complicated, to use very simple words and simple sentences, and let people concentrate on the, on the bizarreness of whatever evolutionary adaptation in a bug you're talking about, rather than, appreciating your long flowing sentences. And one thing that legitimate journalists try to do also is to not hype the science, and to say what's known and what's not known. And of course, I mean, I'm sure we'll talk a lot about COVID, but that's been really important during the pandemic, to say, here's what we know so far, or here's the best evidence right now. Because science is iterative, it's ideally self-correcting, it's always changing. And I think I'll stop talking to get to the next question, but like one thing that helps to sort of understand, especially the longer you read science and health coverage, the more you'll realize, oh, this contradicts something I read just last month, or I know 3 years ago they were saying that eggs are bad for you and now they're good for you. And one of the things that journalists should be doing a lot more of and a lot better is to say, look, science is a process, and nutrition research especially is really hard, and an emerging pandemic of a novel virus is really hard. And so, here's what we know right now, here's how it fits with what we knew before, and say really explicitly that sometimes scientists, the best evidence shifts and people change their minds, and that's part of the process, and it doesn't mean not to trust it.
I was going to ask you about how you approach the journalism with your own team, and you've just described it in some ways. Who do you think of as the person who should read Scientific American? I mean, who is the normal reader? Are they already well versed in science?
Yeah, mostly not. I mean, so a lot of our readers, took science in college or maybe high school and just enjoy it. So we think, there are certain magazines or journals that people read to kind of keep current with their jobs. Like, I don't think many medical doctors read the Journal of the American Medical Association just for fun, but they kind of have to keep up with what's going on in their field. And with Scientific American, we want it to be something people read just for pleasure. And we try to make sure, we use a lot of graphics, we use a lot of photos, both in the print magazine and online, to make it accessible to anybody. So yeah, with our magazine, about half of it is written by journalists, and it's kind of hard to tell who's who, sometimes who's writing, and then the other half is written by experts. And so the experts tend to write opinion and analysis pieces, and they also write feature stories about their own research or about their own fields. So we have a mix of those. Sometimes the expert ones can be a little bit of a harder slog. And so our editors work really hard to help the scientists tell the story in a way that's welcoming to everybody, but those are sometimes a little bit more challenging of the stories we publish.
How do you think that the general press does at covering science? I'm inviting here a critique that may not be totally positive.
Yeah, so thinking of newspapers, local newspapers, especially local TV news, local radio, I mean, they've just lost so many really talented reporters, writers, editors, broadcasters in the past 20 years, but especially in the past 5 years, in the past year. We've just lost so much expertise. And so the news business is trying to do more all the time with fewer people, and with cheaper people, frankly, with more early career people. A lot of later career people have been pushed out. So there's just we just really lost a lot of people who had been doing a good job. So that's with sort of traditional forms of media, and that's pretty much kind of a sad story. And I think it's a dangerous story during the pandemic. There's some evidence emerging that the places that are what we call news deserts, that don't have good local coverage, are the places where you see the most misinformation about masks, about how it's transmitted, about, is it a real pandemic? What should you do if you feel sick? Can children get it? Like all these rumors are circulating in sort of the empty void where there should be strong, informed, evidence-based reporting, and it's just not there anymore. So that part's awful. But there's kind of a different pattern where the people who are doing health and science reporting, it's kind of gotten to be more of a specialty. And so it's a little bit more professionalized. A lot of people go into it for their whole career rather than shifting from like doing sports reporting and business and science and shifting every few years. So now you see kind of specialists who've been covering pandemics their whole careers, and they've really been valuable during the pandemic. But in every beat, you get people who study, who cover space or astronomy their whole careers, and they get to be really good at it and know, who's trustworthy, how, what are the most important stories, how to tell them. And so I think that the real science journalism that exists is getting better, but there's just less of it.
Mm-hmm. If we take that as a given, is there some, and if let me extend on that, if we take that as a given that at the local level in particular, there is a problem in the the knowledge base of the journalists, it seems that it would be more than on the people who are the experts to be better sources and help the journalists understand things better, and to help the public. What would be your advice for a doctor or scientist or researcher who's being interviewed by somebody who doesn't understand it?
Yeah, I think you're absolutely right that, and I think scientists and medical professionals, even before the pandemic, I think we're starting to get that. Like, did anybody go to the March for Science? More than 1 million people around the world marched for science, and that had never happened before, because I think scientists just sort of assumed, well, we're just going to go do our science jobs. And of course, people recognize that science is important and understanding the world is important and inventing stuff is important. And then, after the election and after Trump had spread so many conspiracy theories and was really disdainful of a lot of expertise and a lot of evidence, all these people came out and marched. And I think that was kind of a wake up for scientists to be like, oh, no, we do have to talk about what we do, and we do have to advocate for it, and we need to talk to the public and not just assume people are going to trust us or believe us. And so we need to be people, we need to communicate, we need to write, we need to do op-eds. And there already had been some of this before, and especially around the sort of intelligent design, creationism versus evolution battles. During the 90s, there was a big push by creationists to get creationism taught in science class as an alternative to evolution. And so a lot of evolutionary biologists put a lot of time into testifying to local school boards about why evolution is the basis of all science, really. And it's crucial that if you want students to have a chance of having a career in any kind of STEM field, in medicine and health, or just understanding the world around them, evolution is crucial to basic education. So that really made a difference. In one of the good news stories of the last couple of decades, the percentage of science teachers who teach evolution as science and don't teach creationism as an alternative, that's gone way up. It was 1/3 and now it's 2/3 and rising. So so I think that was good evidence that when scientists really get out there and talk about what they do and talk about why they know what they know or how they know what they know, that can make a difference. So I think there've been these kind of case studies showing that it's worth doing. You got to do it. And universities, I think, are investing a lot in what's called their public information office. And this is typically a part of the administration that puts out press releases, kind of trains scientists in how to speak to the public, helps them write opinion pieces and find a place to publish them. And so that's been a force for good too. The people whose job it is to take what's being learned and known at the university and get it out to the world at large, and hear from the world at large what they want to know.
If speaking of that particular element, there's also that you gave the good news part of that. There's also a tendency of people who are putting out press releases to put out things that are, let's say, misleading, if not, steering people down a path that, when they come from corporations, is aimed at profits as opposed to reality. What's the, again, maybe it's more for the journalist here, and I don't think I want to focus solely on journalism here, but this swamp of information that we're in, some of it, a lot of it's good, but it's on whose job is it to figure out which we can rely on and which we can't.
Oh yeah, it's like the great struggle of our time, or one of the great struggles. People talk about the signal to noise ratio in engineering, and like we're all in this situation where the noise just keeps getting noisier. There's more of it, and it's louder, and it's everywhere. And the noise meaning misinformation, or conspiracy theories, memes that don't make sense. And then the signal is peer-reviewed and evidence-based and well reported, with a journalist who talks to lots of different experts. And signal takes a lot of work. Signal is hard, and especially on social media, where it's really, you just get a little snippet, and it's hard to tell immediately whether how well resourced this claim is. And then, of course, I don't know if you all have talked about the Dunning-Kruger effect. But this is like a really well-studied phenomenon in psychology, where people who don't know a whole lot about an area are massively overconfident about what they do know. And you see this a lot in opinion pieces. A lot of the people who publish, syndicated columns that go to all the major newspapers in the world will say with just utter confidence things that are just wrong, but they're a columnist, so they can get away with it. It's an opinion. So one of the things that we try to do at Scientific American is get experts who know what they're talking about to tell us what they know, and to say it in a way that's just as engaging as the people who can just make stuff up or pass along things they would like to be true that aren't necessarily true. But yeah, it is legitimately hard to tell what's real and what's not.
When it comes to columnists getting it wrong, which is a common occurrence, one thing we do know is there's zero accountability for that. When commentators in the news get things wrong, it seems to be licensed to do it again. And I mean, we all have our favorite columnists who we want to just tear our hair out looking at what they say. But is there, I want to go back to something, and you talk about when somebody sees something or hears something about a study that is, and the word preprint appears somewhere, which unfortunately doesn't always show up in the coverage, even when it is one. What should people who hear or see the word preprint, what should they know immediately? I'm asking you as a journalist.
Yeah, that's a good question. So preprints are basically just rough drafts of a scientific article that nobody's checked the work on. Nobody has peer reviewed it. It hasn't been published. It hasn't been edited or copy edited. Nobody checked the math. And scientists will put them on these preprint servers, just a website where they can share their drafts and seek feedback from their peers before they publish an article. And these preprints were typically just ignored by health and science writers until the pandemic hit. And now there's this tension where it's a fast-moving pandemic. People are dying. We need to know as soon as possible what's been found in studies of aerosol transmission and what's going on in the immune system. What's the evidence for masks? How far do droplets spread? Is it airborne? There were all, especially at the beginning, there's so many just big basic questions, and peer review takes time and publishing takes time. And so scientists quite rightly were taking their raw data, basically, just their draft papers, putting them on preprint servers to share what they know as quickly as possible, so people could, you know, for the most part, you know, make decisions about what kind of treatments to try, you know, when to ventilate people. And so journalists, of course, started looking at these preprint servers too, because to share information with their audiences. And in a way, it, you know, speeds up the process of the dissemination of scientific discoveries. So that part's good, but there's just a lot of stuff that goes out on preprints and gets some attention in the mass media that turns out to just not be real. The study wasn't run correctly, the statistics weren't done right. And so what the more responsible journalists are doing is being very cautious about when we cover a preprint. And if there's something that seems just so important that we can't ignore it, or if it's being kind of misinterpreted in other places, then what we do is basically do our own version of peer review, which is take the preprint, ask, you know, a dozen other experts to read it and evaluate it and give feedback on, like, how well was the study designed? Do you trust it? What do you think the implications are? What should people do in response? And sort of do a journalism type peer review. And then in the story itself, though, still have caveats and say, look, this hasn't been through peer review. This is very early. This is preliminary data, but here's what people are saying about it, and here's what it might mean. And so just extra caveats all over the place.
I see in the chat a question from a colleague noting that science is not designed to be speedy.
Yeah.
And I'll read the question. As readers, how should we modify our expectations of science-based claims when disasters and other contingencies accelerate the need for answers?
Yeah, it's amazing. And science definitely speeded up this year. Partly just the people who were engaged in coronavirus research, especially at the beginning, just stopped sleeping, basically. Like, they just worked nonstop. It's been interesting how it sped up collaborations too. And that was one of the really heartening things that came out, especially at the beginning, is that labs from all over the world were immediately, like, sharing their viral sequences, sharing their methodology, sharing what they knew. And that's why we have vaccines now versus 6 months or 9 months or a year from now, because they accelerated the process so quickly. And it'll be interesting to see if that speed is maintained. I would be surprised. I don't think it will be. I think for most scientific questions, there's not so much urgency. And so I think people will continue being sort of methodical, doing things within their own lab before they share them on preprints and share them with collaborators or competitors. So yeah, I think that some things will probably be speeded up. Clinical trials, I think, will never be as slow as they were. I think there are a lot of efficiencies that we thought, oh, we could never do it this way. And like having a conference on Zoom, we thought, oh, that would be really hard to do. And now it's just routine. So I think a lot of the process of science will be speeded up because of that. But yeah, we should always be, I guess pretty much all science is, not tentative, but it's all subject to review, and things do change a lot, which is hard. If everybody, of course, you want certainty, and when you follow scientific fields, like it's just as things change, you really notice the uncertainties.
Science has been adjusting. How should we, as readers and listeners and viewers of science, be adjusting to that rapid pace?
Yeah, one thing that's been impressive is how quickly the audiences have come along. And partly, there wasn't anything else to do for a while. There was no sports, no theater. And here's a terrifying new confusing pandemic. So people were paying so much attention to the pandemic, especially the early months. And we saw it. I was at the Washington Post when it started, and I transitioned to Scientific American in April, almost a year ago, and other places too. The New York Times. Every publication that was publishing regular information about the pandemic had just massive traffic, and those were the stories. Like the Washington Post was still publishing articles about politics, but for once people weren't paying as much attention to that and were really, really focused on this coronavirus. And what's been interesting is seeing like just how much language has evolved, and language and conceptual understanding. So people know so many terms of basic public health now, like, asymptomatic transmission and R naught in some cases, and the patient zero. Like, there are all these concepts that were part of public health, and now everybody knows these words, and everybody understands a lot more about the immune system and how how long-term effects can happen, and how transmission works, and how masking works, and aerosolized. And so I think people's knowledge about science, especially medical science, has really gone up. And there's this phenomenon, psychology phenomenon. The more you know about something, the more interesting it is. So, like, I don't know a lot about certain sports, and so if I started reading articles about them at first, I'd be like, yeah, whatever. I don't even get why this matters or why it's interesting. But then the more you get into it, then you kind of understand the subtleties, and it feels familiar, and it's like fun. And I hope that that's happening for health and science, that more people are understanding, okay, first of all, I can get this. Second of all, it's really fascinating and important, and I want to know more.
I want to be sure we get to other folks' questions. I don't want to be the only one asked. Christy, you're waving a finger.
Well, you say your next question, and then I'll go after you.
Well, it's about some kind of a core problem, I think, in the last year, is the institutions we should be able to trust have either made stunning errors or have quite visibly been corrupted. And I wonder what we should do as people who want to trust things, and to know that we can trust things more than not. And there's a feeling of helplessness for me anyway at some point.
Yeah, almost 600,000 people have died in the US, and it didn't have to be that way. Absolutely didn't have to be that way. The Centers for Disease Control and Prevention had all kinds of, guidebooks and lessons learned and principles for how to handle a pandemic, how to handle the communication, how to handle vaccine distribution, all these things, they had planned for. They'd had done pandemic drills every year for years. And so then the Trump administration just ignored all this knowledge, denied it, just made the absolute wrong decision at every step, and not out of accident. It's not like they just didn't know enough. I mean, they were manipulating information. They were sharing disinformation and misinformation, and the consequences are still echoing. We still have people who believe what Trump said about it, and are not engaging in the best practices and endangering themselves and others. And we're still recovering from that, and some people will never. I mean, they'll either die or they won't recover from it because their minds have just been so misled about not trusting doctors, and that it's a conspiracy, and masks will suffocate you, and just all these really vicious untruths came out from the highest levels of government. And it's so bad, and I think we're going to be reckoning with it for a long time. Because of the extra, and some of the mistrust is well placed. I mean, there were a lot of government agencies that weren't trustworthy during the Trump administration. But one of the kind of poisonous things he did was tell people not to trust the press, and he repeatedly said the press is lying about the coronavirus pandemic. And at that time, because the federal government wasn't sharing real information, and in the local and regional health officials were very spotty about which ones were trustworthy. And so the press was sharing the best scientific information, and scientists were sharing the best information. And so saying don't listen to them was just, not just cruel, but literally deadly.
Yeah. Christy, what?
Actually, I was going to ask a question about that. There were a couple of people that put in the chat something along the lines of comment. And there's a comment that these days, I would say the rock group, the WHO, is more believable than the World Health Organization, which that was kind of clever. But it kind of to Dan's point, where we have these institutions that we are supposed to trust, and they're set up to be the voices of information, this kind of information. And then when they make mistakes intentionally or otherwise, it breaches that trust. And I guess I'll ask the question in a different way, which is, how do you approach, how do you address these institutions, knowing that there is this confusion around how trustworthy they are, but that they remain the consensus organizations, you know, the national, the global level for these types of information.
Yeah, it's been really tricky. I mean, I think especially for kind of classic newspaper journalists tended to know, okay, probably the FBI or the CIA might lie to you. And so, you know, you go in expecting to dig and investigate and find out what the real truth is. But typically health reporters are like, yeah, the CDC says that it's, you know, it's their best evidence. Why would they lie to us? And then they, you know, basically stopped communicating, and their press releases were run through their political appointees. So, you know, the people who work at the CDC, who are career civil servants, who are scientists working at the CDC, there's no reason not to trust them. But the message from the CDC was put through like kind of the upper level of political management, which distorted a lot of the information that came out, especially in the early days. And so they weren't trustworthy. And that took a while for journalists to kind of reckon with, and do the messaging that, you know, the CDC data is still in CDC guidance about, you know, stay home, keep the schools closed, you know, don't go out to eat, like that's still reliable guidance, but there's a lot they're not telling us. And that message kind of zigzagged quite a bit, I think, over the course of the year.
I guess I'll ask you to, we do that comment about the World Health Organization it's funny, and there's an element of that they've made some pretty staggering missed calls early on, for sure, right? How have they done since the insistence that a mask was a bad idea?
Oh, that was bad. I mean, if we could go back in time, I think that was the biggest mistake that the Western media made, was dismissing this idea that masks can prevent respiratory diseases from spreading in a population. And yeah, I really wish at the time I was working at the Washington Post, and one of our health reporters had been a China hand. She'd been a reporter in China. And somebody was, you know, we were trying to decide, well, how good is the evidence for masks working? And she sort of said offhand, ask any doctor in Asia and they will tell you it works. And it, you know, it does. There wasn't something published in, you know, in the Lancet that had done a case controlled, placebo controlled mask study. And so we didn't have like studies we could point to. So I think that, you know, the early days, of course, there was a lot of xenophobia, and there was just a lot of kind of ignorance of other ways of handling pandemics, and sort of I think a little bit of a Western medicine and Western journalism sense of superiority that, you know, if it hasn't been in a peer-reviewed journal, it's not true yet, and we can't say it's true yet. So that was a problem. Yeah, but the WHO, I mean, I understand. So they primarily, they didn't want people to panic, and looking back, we should have panicked. And they didn't want to have shortages of materials, of masks that people needed. And that made sense, but I think the messaging throughout could have been clearer. Like, yes, masks work, but please don't hoard them because, you know, people on the front lines need them. And that's like a little bit of a subtle message. But I think if they trusted people with that message, and if journalists had been more clear about that message, that we might have had a better outcome.
What do we know about that question of if people tell it to us straight, even though it's complicated, are we going to get a better result? That we all want to believe that.
Yeah.
Is there data to show that that's true?
Oh, that's a good question. I hope somebody's studying that. I mean, there's so much social science happening during the pandemic because, you know, we're in the midst of like the biggest behavioral and psychological experiment in history. So I don't know. You know, it's one of those things. I want it to be true so bad that I haven't actually looked at the evidence. But that's a really good question. I hope somebody finds out.
As a columnist, I would have insisted that this was true without any data to back it up. But
I have a question that someone sent to me that takes us on a slightly different track. But the question is, how does a journalist keep their ego out of a story? And so I mean, we can talk about specifically science journalism, but journalism more broadly. And is there a tendency to imply they have expertise or bias when writing a story? And I guess I will add my own little challenge to that question as is that a bad thing?
Oh, yeah. No, that's a good question. And so I'm an editor, and I've always, pretty much always been an editor. And one of the reasons that, so editors tend to, they don't write the story. Our names aren't on the story. We don't have bylines. It's not authored by us. So it's a little bit different for me as an editor. But that is one of the things that editors try to do, is make sure that the writer who they're editing, that the journalist they're editing doesn't let their voice or their expectations drive the story. And it's tricky. I mean, you want to have writers, reporters who, know a subject well enough that they know, who's trustworthy to talk to, how to frame it, what's the history, where does this question come from? And so you really want somebody who knows what they're talking about, but you don't want them to be the story, or to be too present in the story, or get in the way of the story. And this is something that shifts back and forth, and it depends a little bit on who you're writing for. If it's a newspaper, that they tend to, you never tend to see the word, I, like, I interviewed so-and-so, or so-and-so told me this. But in a magazine, sometimes it is a little more kind of informal, and sort of, the process of reporting is part of the story. And that, there's shifts in journalism trends. I think right now we're kind of in an age of exposure, or kind of personal journalism, where journalists are, they're real people on like Twitter and on social media, other social media. And so it seems like it's more of we're kind of in a trend of humanizing the reporting. But I think you can do that without having arrogance, without having the reporter think they know better. The reason they know anything is because they talk to other people, and have throughout their career talked to other people who are doing the primary research, who are analyzing things, who have the expertise. And so you can accumulate the expertise, but I think that it's really important for journalists to know that it's secondhand expertise. That they're not the ones who hold the knowledge, but they're sharing the knowledge with the rest of the world, and that's a different skill.
If we if we were to let's say everyone on this call, and then they asked everyone they know to do the same, were to get in touch with a local journalist in their community and ask them to do one or two things about coronavirus coverage, or health coverage, science coverage in general, what would you ask them to say to their local media people?
Oh, that's a good question. Yeah, I mean, I think that, the advice has shifted over the course of the pandemic. I think, at the beginning of the pandemic, there was this sort of, self-protective idea that, oh, the only people who are at risk are, old, or have a condition, or, whatever the risk factors are. And so early in the pandemic, some journalists kind of fell for that. And so I think one of the things they needed to know was, look, people who have underlying health conditions are people too, and they should, be a little less heartless, and show that these are real human beings, and that the people who are caring for them, who are, cleaning their hospital rooms, who are helping them breathe, that they're people too, and that they're undergoing just terrible trauma. And some journalists did a real good job of that, but I think that was sort of the most important thing to do at the beginning, was to humanize it and show it's real and it's not something to ignore. And then, of course, masking. There's still so much resistance and fear about masking, and so I think something that journalists can need to keep doing, because there is so much resistance, is to keep explaining just the basics. That wearing a mask, sure, it's kind of uncomfortable. It can get kind of hot and sweaty in there, itchy, but you're doing it, you are protecting yourself, but even more, you're protecting everybody else and protecting them from the disease, and also just putting people's minds at ease too. Like if people are scared to go outside and you're out there breathing without a mask, it's really, it just makes everybody tense and scared. So just be respectful by wearing masks and showing that that's, you know, and then that wearing a mask doesn't mean you're un-American. And you can be patriotic and wear a mask. So that was kind of an important, continues to be an important message. And right now, I think the most important thing is that journalists really have to get the vaccine straight and just be very clear about, here's how we know. Sure, it was fast. This was a really fast rollout, but it's been tested in so many people and the data are overwhelming that it will, you know, prevent you from getting sick and dying with this preventable disease. And it will prevent, and now the evidence is coming out that it will prevent you from passing this disease to other people if you're vaccinated. And so, sure, it's, you know, it's right to have questions, to, you know, to want to know the evidence about some new medical treatment, and you're right to ask, and here are the answers, and to just make it really clear and accessible for people, because you know, it's a decision. It's kind of a hassle to figure out how to get signed up for vaccines, and of course that's another thing that journalists need to be doing, is holding local public health systems accountable for making the vaccines accessible, making it easy to get them, making it clear how to get them and who's eligible, and really making sure that they're distributed in an equitable way.
One of the things in the vaccine world predating coronavirus and COVID has been, and I would call it a very unfortunate intervention from a small but influential group of celebrities to persuade people that vaccines are a bad idea. I want to focus on something that we don't talk about a lot, but every community has kind of local celebrities, people who are known in the community to be important people for whatever reason, as opposed to national, international celebrities. What can they do to convince their friends, relatives, community members to be vaccinated and to take this seriously?
Yeah, that's a great question. And I think that the vaccine selfies are such a good public health principle. Like, you know, some of the vaccine centers have like a designated selfie station. So you go through the line, you get your shot, and then there's a place where you can stop and, you know, and have a picture with your, I got vaccinated sticker, and then share it on social media. And that's so nice. Like it's so equalizing, because everybody looks everybody looks the same in the, you know, kind of harsh overhead lights, and you've been waiting in line all day, and there's this expression of kind of relief and gratitude and joy and like shared trauma and, you know, hope that we're getting out of it, and those expressions are just so powerful. So I think, you know, people can be a celebrity to their, you know, immediate friends and family by sharing that image, but I think that, you know, the local celebrities, you know, the local sports heroes, and even in some cases, I mean, this is, you know, this gets kind of at the boundaries of journalistic ethics, but like the meteorologist, you know, the weather person on the local TV news, like people pay attention to them, and if they would share those shots too, I think that could be helpful. Yeah, just kind of normalizing vaccines. And one of the reasons that the anti-vaccine movement is so powerful is because they present it as, you know, weird and, you know, dangerous, and needles, and what are you doing to your children, and you know, there's no such thing as measles, and it's not a bad disease, and so they had all these talking points before. And so I think the more that we can kind of normalize that, yeah, the needles, it'll hurt for a while, you might feel gross, but everybody's doing it. They're doing it to protect themselves, to protect you, and it's completely normal and safe. And come and join us at the vaccine center. You know, we'll all be glad to see you there.
I see a related question from one of our guests. How can media get primary care physicians involved with promoting vaccinations?
Oh yeah, that's a good idea. And, you know, people, there are all these surveys that the like Pew and other survey firms put out looking at, you know, who do people trust? And overwhelmingly, people do trust doctors and nurses. And that's something we've been trying to do more during the pandemic is quote nurses as well, because they often have, you know, more direct interaction with patients and you know, more awful stories about what this disease can do. So one of the tensions has been that they're just so busy. I mean, they're exhausted. They've been working so hard this year under just the most terrible circumstances, and they've seen such trauma and lost so many patients and have been at great personal risk by working through the pandemic. So you know, whenever journalists can show them as people and let people hear their voices and see their faces and see the worry lines and the mask lines, I think that's just super powerful, and it grabs people's attention in a sort of welcoming and you know, it's such difficult stuff to talk about, but people do want to hear what doctors and nurses have to say, and I think they can be very powerful as sources for journalism and as messengers.
I have a question. Can I ask a question? I was just curious. So if you could talk a little bit about Scientific American specifically, so a magazine that comes out monthly, right? And then you have a website. So I'm just curious to know, and over the past year, and then maybe now that, I don't know, we're in some sort of pandemic groove or something. But like you obviously are planning longer lead time, right? So some long game stories, but then you have the day-to-day to deal with. So I'm just curious if you could talk a little about the process of how you're facing what's happening with new news every day, plus like what's our August issue going to look like?
Yeah, it's tricky because things are changing so quickly. And I think the ratio of, you know, urgent news, publish this today, publish it in this hour, you know, the ratio of those stories to kind of the thoughtful, leisurely, here's what we've learned in the past 10 years about, you know, about bats are a different example, about elephants. That, you know, we definitely have not been investing as much in those kinds of stories. And it's partly because the longer term stories typically involve travel. You know, we would send somebody to, you know, Namibia to take photographs and interview researchers who are working on elephants, and that can't happen. So we've really been doing a lot more clinical stories and a lot more, you know, pandemic related stories. The pace has been really brutal. And that's something journalists have, you know, this year with the pandemic, you know, with the social justice movements, you know, with the election, everybody's just pooped who's been working in journalism. It's been a really, I mean, it's been a really hard year for everybody. But yeah, for journalists, they're really exhausted. And I think this is, you know, now that they're starting to get vaccinated and you know, it looks like this thing's going to be, you know, get throughable. Now we're starting to think about, okay, what does the world look like after COVID? You know, what changes are permanent? What are the long-term consequences going to be for society, for social justice, and for the way science works, for what we know about the universe? And we're anticipating a lot of really interesting findings from all the social science, from the, you know, all the social science, all the medical science. You know, what happens if people stop getting mammograms for a year, basically? You know, are there going to be long-term consequences for cancer screening, you know, for, you know, where are cancers found, and dental work? Like what kind of, you know, long-term consequences are there for people's teeth because they didn't go to the dentist? So we're starting to think about, you know, what are some of these longer term stories related to the pandemic, and also trying to you know, just remember that there's so much science that's been going on anyhow, you know, about volcanoes and about, you know, the universe and all these other kind of fun things. And I think we felt a little bit guilty focusing on Mars during the worst of the pandemic. I mean, we still did it. And, you know, people need to think about other planets when this planet is a distressing place to be. But now I think we're starting to relax and think about, okay, how can we bring more joy into people's lives, in the joy of discovery that doesn't necessarily have to be a life or death type of story?
May I follow that one up with one of the, it strikes me anyway, as one of the great things to come out of this in a positive way through all this terrible stuff has been the well, maybe a couple things. One is it turns out you can actually, it turns out to be true that if you throw money and talent at some things, you get results. That's one thing. The other, but the mRNA vaccines. I don't know enough, but that feels like one of the really important breakthroughs in human health in a really long time. Should we feel really good about the future of that technology?
Yeah, absolutely. I mean, this is the just amazing medical progress in record time. And yeah, I think, there'd been a lot of basic research on mRNA vaccines, and after the first SARS epidemic, unfortunately, it didn't continue to be funded at the right level. But the fact that scientists were able to ramp it up so quickly, and that, manufacturers were able to produce it so quickly, and the way the clinical trials happened and all that, it really does show how much is possible when you really need to do something, and everybody's pulling together. Mostly everybody is pulling together. You can really make huge progress. And so what other long-term problems that seem intractable are actually quite fixable? But with mRNA vaccines in particular, there are just a lot of other viruses that probably mRNA vaccines will be very effective against, including new varieties of the SARS coronaviruses or MERS coronaviruses. And the idea that we could just ramp up vaccinations really quickly because there will be spillover, that there are thousands and thousands of known coronaviruses in animals, and any one of them could potentially spill into humans. So it's still super dangerous, but we're much more protected than we would have been thanks to this just amazing research. And the vaccines worked much better than anybody expected. Part of it's luck, and part of it's, just trying to manage expectations, but these really work well.
I think we're heading down the home stretch here. Christy, Celeste.
Yeah, I was just going to make a call out to say we have a couple minutes left if anyone else wants to put a question in the chat, or if it wants to unmute themselves and ask a question. And I also just want to point out that I really like that positive note that you just kind of let. I mean, we could end on that positive note, but if anyone has another question, that's great. There's lots to think about for the future, which is a great kind of place to leave it. But if anyone wants to say any parting words.
I'll just ask what message you want to send to people listening here, Laura, on about science. I just you're in such an enviable place to help us know why it matters. What do you want to say to us?
Yeah, it's imperfect, and it's sometimes progresses haltingly, but it really is the best way to understand the world. And one of the most active areas of scientific research, especially last year, within the past few years, has been misinformation, like the study of misinformation as a scientific subject. And we've really learned a lot about it. And I think one of the biggest outcomes is, one of the most replicated findings, one of the most robust findings, is that people have much more power than they may realize to improve the signal to noise ratio in their communities, and in their friend groups and their social media groups. So I think I want to thank everybody for being part of this class, for being part of this discussion, and hope you feel empowered to share interesting scientific findings, reliable science journalism to share with your friends, and if you see misinformation, to feel empowered to call it out, or to counter it with real information, because it's such a battle of the people who care about reality versus the algorithms or the bots or the bad actors, and we're all in this together. I think we all have a mission to make the world a better understood and a better run and a more equitable place, and to increase the signal to noise ratio. So really glad that we could talk about all this, and I thanks for caring, and for wanting to share real information all around the world.
Well, an honor to have you with us. Thanks very much. Thank you so much, Laura. This was really interesting and fascinating, and so much to think about, and really appreciate your time. Thanks to Dan and Celeste and Mediactive course team for being here. And thank you all of you for attending and participating. And it's great to see you all And we look forward to our next event, which now, of course, I don't know what it is off the top of my head, but maybe Celeste does, or you can check our website for the schedule of events, and we'll be tweeting and sending announcements and all kinds of stuff. So thank you very much again. Hope you all have a great rest of your day. Take care.
Thanks a lot.
Bye.